started. Hi, everyone. Good afternoon. Welcome to our last session of the year for our San Joaquin Stanislaus Collaborative Planning and Implementation. Excited to have you all here with us today. Next slide. Just a friendly reminder that this meeting is being recorded and it will be available after the session if you need to go back and review anything. Next slide. Alrighty, next slide. Okay, so we'll go ahead and get started with some of our usual housekeeping reminders. If you haven't already, please feel free to update your name on Zoom and include the name of your organization. For our chat icebreaker today, which we can also drop in the chat, thought it would be fun to do something holiday themed and ask you all what your favorite holiday movie is. For me, it's definitely Home Alone. Love that movie. And then, per usual, we're looking forward to a dynamic session. Please feel free to use the chat and the hand raise function as needed for questions, networking, and feedback. Also wanted to note that we will be doing some polls throughout the session just to limit the amount of surveys that you all get from us. And these polls are around our end of year measures, so really appreciate your feedback on those. Next slide. And then actually I should see, I also see another comment for Home Alone, which is great. And A Christmas Story and Elf. So I see some popular movies in there. So hopefully this inspires us to go watch some of those movies during our break. For anyone new to the room, welcome. Thank you for joining us. Our CPI meetings are a space for regional CalAIM stakeholders to come together to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. So welcome aboard if this is your first meeting. Really glad to have you here today. We've also linked on our slide our projects folder if you would like to check out any of the resources that we've shared, as well as this is where you could find the monthly slide decks. But did want to create some space if there are new folks that are attending this meeting for the first time. If you would like, please feel free to unmute and share a brief intro. We would love to get to know you. So I'll just pause for a quick second if there are any new folks that want to say hello.
Hi, my name is Deja Marie. I am the founder and CEO of An Insightful Journey. We are a nonprofit in the area that's driving health equity through creative initiatives and storytelling, as well as community level interventions.
Awesome.
Hi,
Thank you.
everyone. My name is James Mackey. I'm Case Management Department Program Manager at Community Medical Centers.
Awesome. Great to meet you both. Anyone else?
Good afternoon. My name's Marianne. I'm the Director of Health Services at St. Mary's Community Services here in Stockton.
Nice to meet you, Mary.
I'm Juliana Frazier. I'm from Koinonia Foster Homes, and this is the first time I'm attending, but we've been involved in ECM. So this is the first time attending for me.
Awesome. Great to have some new folks join us today. Okay, I think we can go to the next slide. Okay, so for today's session, we have lots of things planned. For today's session objectives, we will stay informed with updates on MCP, CalAIM, landscape, and peer activities. We'll also receive up-to-date details about the upcoming cited round 4 funding webinars, as well as related resources that have been released by DHCS. We will also highlight organizational achievements. So we have some provider spotlights to talk about their successes in delivering enhanced care management and community support services in San Joaquin and Stanislaus. And then we will engage in some initial discussions to talk about our 2025 collaborative goals. Next slide. Okay, so for today's agenda, we are in the welcome and level setting, and then we'll move on to some updates and resource sharing. So like I mentioned earlier, we will share some updates around Cited, some new information around some webinars, as well as resources that have been released by the state. And then there are also some general updates that will uplift. And then we will have some MCP updates. So we have some presentations planned from Health Plan of San Joaquin, Kaiser, and HealthNet. And then we'll move on to our 2024 collaborative successes and provider spotlights. So we have three providers that will be spotlighting today that all provide medically tailored meals. So looking forward to that part. And then we will have some time for some regional spotlights. And then we will close out with some next steps and planning for 2025. And that will take us through the end of the session. Next slide. Awesome. Next slide. Okay, so for those of you that have attended a lot of our recent sessions, this will be very familiar to you. But just a quick reminder that the Cited Round 4 funding opportunity, which is a funding opportunity available through the state to help organizations stand up their capacity and infrastructure to provide ECM and community support services, will open on January 6th and close on March 7th. This is the final round of funding for Cited, so really want to make sure to uplift that to you all. And just as a quick reminder, these are the round 4 priorities that have been shared by the state. So really focusing on statewide ECM and CS needs, as well as county-specific gaps that need to be addressed, whether it's an ECM by population of focus or community support services by community support type. Also placing an emphasis on supporting our tribal partners and providers, as well as counties providing transitional rent. And then at the bottom, we also have the email address that you can contact for any questions related to Cited. Next slide. And these are the round 4 funding webinars that will take place shortly after the state releases the application in January. So just wanted to call those out for you all. The first webinar will be an informational session that will be hosted the day after the application is released, and they'll be providing an overview of the application process, including how to apply, as well as answering frequently asked questions. And then the other 2 webinars are centered around how to make your grant application stronger. So the first part of that webinar will be in mid-January, and they will review topics like what reviewers are looking for when scoring applications, also sharing general tips for writing a strong grant application, as well as clarifying funding goals for round 4. And then the second webinar, which will take place in early February, will review the funding request workbook, talking about DHCS guidelines and restrictions, as well as sharing strategies for creating a budget. And I think we're also going to share in the chat, but a few resources that have been shared by the state is their round 4 guidance document, which I will give a disclaimer is pretty lengthy. I think it's around 40 pages, but has a lot of useful information that will also be covered through the webinars, but also talks about things that you should expect, as well as eligibility criteria, allowable uses, and highlight some of those frequently asked questions. So I do recommend, if you have the time, to review that document, as well as they did release an application outline that provides a preview of the application and kind of what to expect when the application does become available. do want to give one note that this isn't what the final application will look like, in the sense that they might still make a few changes, but will give folks a really good idea of what to expect. And then the last resource is the funding request workbook, which is where you'll submit your budget along with your application. So just wanted to call out some of those resources and webinars. We'll continue to share this information with you all, but wanted to share this in advance so you could block off your calendars. Next slide. And then this is just a quick overview of the timeline of events just to expect. We are going to talk a little bit more about the Cited Round 4 Learning Lab that we're hosting on Friday, so we'll dive into that in the next slide. And then just highlighting the dates for when the application will be released and when it will close, as well as highlighting that we do plan to provide some additional support in our January session, as well as we are planning an in-person session. So we'll hope to save some space to answer any remaining questions that folks may have in advance of the deadline. And then on the right side are just some of the allowable uses for this funding opportunity. So just wanted to share that as well. And then next slide. Okay, and then I know I sent out an email about this as well, but just as a quick reminder, we are hosting a Cited Round 4 Learning Lab that will be an interactive session that we will use as an opportunity to provide an overview of the funding opportunity, talk a lot about some of the information that you can also find in the guidance document, like the eligibility criteria, allowable uses, talking about the application, budgets, and more. We are going to have this session be more interactive with different breakout rooms depending on your interest and experience level. So please come with questions and use this as an opportunity to learn from your peers and gather best practices. We really want to create a space for us to have multiple touch points so folks feel prepared when submitting their application. So just a reminder that it is this Friday at 10 a.m. We can drop the registration link in the chat. Just one note, the registration link will say San Joaquin Stanislaus office hours. That's only because we're hosting this session during office hours. So just want to make that note to limit any confusion. And then in terms of who should attend, we highly recommend staff from health and social service organizations that are already contracted or actively in the process of getting contracted to provide ECM and community support services, since that is a requirement of the funding opportunity. To apply, you have to either be contracted or have a letter of attestation. And then in terms of types of staff, highly recommend your grant managers, budget planners, program administrators, contracting specialists, leadership, and compliance staff that are familiar with Medi-Cal MCP contracts to attend. So just wanted to uplift this opportunity. I think it will be a really great opportunity to start planning in advance. Next slide. Okay, and then a few more updates that we wanted to uplift from DHCS. DHCS has released 2 new data sharing authorization guidance housing and re-entry toolkits. And these toolkits are intended to complement previously released guidance that the state has put out, which focuses on real-world scenarios to help on-the-ground providers and organizations navigate data privacy and data sharing laws and regulations related to the delivery of Medi-Cal housing services and the re-entry initiative. So we'll drop the link in the chat for the main webpage where you can view the toolkits. And these toolkits our aim to help clarify when, why, and under what circumstances consent may be needed to share sensitive health and social service information under relevant data sharing laws. So highly recommend you all check that out. And then we've also linked to the survey, which you can use to provide your feedback to the state by January 8th, as well as the email address that you can contact for any questions. And then next slide. And another update that we wanted to share was around a provider education opportunity for the SOAR model. So we know that supporting ECM members in applying for supplemental security income and or Social Security disability insurance benefits is an important part of the care plan goals for members, but it's often can be time consuming and complex to navigate. So wanted to uplift this free training resource that is created on the SOAR model, which can be used to help support individuals when applying for benefits. And it has been shown to help increase application approval rates. So we can share, or either in the slide or in the chat, we'll have the link to where you can find out more information. There is a brief video that folks can look at that provide a little bit more of an overview of what to expect. And this training course does take about 20 hours to complete, but you do get 20 continuing education units that are available from the National Association of Social Workers. Next slide. Okay, so we're going to move on to the next section, which is MCP updates. But before we do that, we are going to launch a quick poll. So we will launch that soon, but this poll is around contracting knowledge. So this poll is asking whether your knowledge of the key steps involved in CalAIM contracting has increased due to your participation in the collaborative. So we'll ask for you all's feedback on this question and appreciate your response. And we'll give it about 30 more seconds. Okay. I think we can go ahead and close that poll. Awesome. So see a good spread of folks with some agreeing, some neutral, and maybe a few disagrees. So we can stop sharing. Okay. And then next slide. Okay, so now we will move on to our updates. I think first up we will have Niyati from Health Plan of San Joaquin. So we can go on to the next slide, and I will pass it to you.
Thank you, Navneet. Good afternoon, everyone, and happy early holidays. I'm sure everyone's excited for the upcoming holiday season. So thank you all for joining for the December update, and I'll go ahead and share the slides here. So if we can go to the next slide, please. So really, we wanted to kind of focus on to reiterate our ECM referral procedures. So as you know, part of the process here is obtaining an ECM referral form, and that can come from any type of sources, right? It can come from family members, it can come from a primary care physician, a member can self-refer. How this process works is that we, if you do see someone that is eligible for ECM, or you have a family member, or you are seeing a patient, please download and complete the ECM referral form. This is a referral form on our CalAIM portion of our website, and I've included a link here, and we can drop some of these links. That way you can keep it in in your favorites as an opportunity to download. And what you do is you complete the either the adult or the child ECM referral form. And there is a screening checklist, of course, to confirm eligibility again. If you determine that the member meets the ECM criteria, we're requesting that you complete the entire form completed in full and submit the referral form via fax. So I've highlighted here the fax number. It is also located on the ECM referral form that you can download. The health plan will review the screening questions and submit the referral to the appropriate ECM provider. Okay, so we are going to submit all of the forms based upon the referral to that associated ECM provider. As you know, we do have a lot of ECM providers on the call, so if you have any questions, do let them know. But again, we will conduct all the screening questions, we'll review it, and then submit to the ECM provider. If there's like a specific section that you're unable to complete or have questions on, or if you don't know how to answer, feel free to contact our care management department. So I've highlighted this important phone number as well. So keep all of these numbers handy. One is a fax number on bullet 2, and bullet 3 is our care management department phone number. You folks will let me know if there's any questions. Navneet and team. In terms of community support referral procedures, we also have a community support referral form as well, located in the CalAIM section of our website. And I'll go ahead and also share, or Navneet actually shared, where you can find that information. This is where you complete and fax the referral form to the provider. So please note, it's different than the ECM process. So what you typically do is you look in our provider directory for the associated community support provider. We have a list of their services per community support provider, and you will complete either email or fax the referral form to that specific community support provider. So if you're looking, for example, if you're looking for meal services, we have multiple medically tailored meal vendors, and they are located in the provider directory. And if you need to refer a member to the MTM provider, you feel free to fax it over or email it over to that specific community support provider. Please note, if you need assistance with obtaining a prescription for home modification or asthma remediation. So please note, specifically for health plan, what is really important for the DHCS guidance is to obtain that prescription for both home modification or asthma remediation. If you need any assistance, you can contact our UM department. And I've left 2 phone numbers here to assist you. We do have a customer service department as well. I've left the number here too. It's that 1-888-936-7526 as well. Monday to Friday from 8 to 5. They can also direct your call if needed. Navneet, I'm not sure if I have another slide. Great, okay, perfect. So as you know, there's the CalAIM webpage that Navneet dropped in terms of where you can locate a lot of useful information. We have the ECM as well as the community support referral forms. For ECM authorizations, we also have, where you could do the eligibility verification authorization form. And then, of course, any questions, feel free to call the associated department. And next slide. And again, in summary, here are the key contacts. I will pause here and answer any questions. Again, here you have is the care management, which is a team dedicated for enhanced care management, the utilization management department for community support, customer service for just questions in general. And then of course, each of the providers that are on the call that are contracted with Health Plan of San Joaquin, you do have a dedicated provider services rep that can always assist you. But if you can't get a hold of them, please locate the number below for provider services. Any questions for Health Plan of San Joaquin? Okay, Anthony, what is the typical decision time when you submit an auth for ECM? Anthony, what do you mean by typical decision? When we approve that auth approval time? Okay, I am not in medical management, so I am going to scribble that question down, and while we talk, while the other MCPs provide an update, I will confirm the auth decision time. I do want to let folks know that, as you know, I'm sure everybody received the ECM standardization that DHCS published on an updated guidance, where, you know, we need to operationalize by 1/1/25. This is where, you know, regarding authorizations. Health plan will be submitting a provider alert before 12/31, but this is a new decision that's going into effect beginning 1/1/25. Beginning 1/1/25, the ECM provider may begin providing services without an authorization, but just the first 30 days. Okay, so no authorization is needed between day 1 to day 30 when you see an ECM member. However, before day 31, the ECM provider must submit an authorization to health plan to continue services for the member following the usual process. So it's up to you folks, whether you want to just work through the authorizations between day 1 to 30, or you prefer to provide services without an authorization the first 30 days. Remember, claims for ECM services provided from days 1 to 30 will pay without an authorization, but if we don't have an authorization by day 31, claims will deny. But there will be a provider alert. Medical management will be releasing that very shortly. Our referral request by fax only. That is correct. My understanding, the referral request is by fax only. If the auth is approved as parent, yeah, that is correct. So if the auth is approved, the payment is guaranteed.
Hey, Nayeti, can I add something?
Sure.
So when we put in an authorization and it's, you know, submitted correctly, the usual time is between about 3 to 5 days that we get a response from Health Plan of San Joaquin stating that authorization has been approved. That's if the, like I said, if the authorization is submitted correctly with the appropriate documentation. If not, then, you know, it will be either, you know, delayed. And that can, you know, depending on who's working on it, one of the case management nurses getting back to that provider to get that required documentation. So that could delay it. But if you do a perfect authorization with the appropriate information, it usually takes about 3 to 5 days, which is pretty fast.
Thank you, John. I so appreciate you for sharing the process.
No
so
problem.
hopefully, Anthony, that helps you what John just mentioned. You'll hear more regarding our decision on the presumptive authorization process. There will be a provider alert that will be released. It's still being drafted. We're getting all of our systems prepared for this. So, but I did want to give you a little bit of color about what is coming based upon that recent guidance. So any questions, please hold them until we get that provider alert out. But again, that is a 1/1/25 decision.
Hi, Nancy. Can I ask you a
Yeah.
question around what you said?
Sure.
For the first 30 days after the members enroll in the ECM program, I just want to make sure that no authorization required means no retro authorization as well.
I will have to get back to you because that NICE, that's not right. I'm overseeing just the provider network. I will let medical management I will ping them right now and determine that.
Okay, thank you.
Great. Any other questions from stakeholders on the call? Well, thank you again for a great partnership this year. I really appreciate it. I'm wishing everybody a happy holidays from me and Health Plan San Joaquin. Thank you again.
Thank you, Nidhi. So we can move on to KP. So I'll pass it to Camille.
Thanks, Navneet, and apologies, I'm off camera today. I'm feeling pretty under the weather, but thank you all for letting me kind of take some time and walk through some KP updates for this month. You can go to the next slide. I wanted to share that we've recently released a number of Kaiser Medi-Cal member-facing resources. We have one for supportive housing for Medi-Cal members, both for children and youth, just general ECM and CS flyers, and then guidance around if you're a Medi-Cal member, what can you kind of, what services can you receive under Kaiser Medi-Cal? And thanks, Melissa. Melissa just dropped the link to the Google Drive that has a number of these flyers. I believe in the drive, it might just be English and Spanish, but we have a number of different other threshold languages. So if these are things that you're interested in kind of sharing with your members and need additional languages, feel free to reach out to me, and I might actually try to drop the document, the PDF files directly in that Google Drive, Navneet, after this, if that works for you too. So I wanted to share this as a resource. If you go to the next slide. Wanted to share a couple of very high level reminders. We have this complex care certificate. I'll drop more information in the chat. 13 free CEUs for folks that are providing complex care to members. You don't need to be contracted with Kaiser, and it is totally kind of self-paced. We have a number of spots still available, and it'll be available through the new year. Next slide. And then you can go to the next slide. This is just a little bit more about the complex care certificate courses. Okay, thank you so much. So last month I presented on kind of an overview of our network lead entity model, just reminding folks, you know, what our model is, who we partner with, and what do those referral processes look like. So as a reminder, Kaiser partners with 3 network lead entities, 2 specifically in San Joaquin and Stanislaus, Full Circle Health Network and ILS, to contract directly with providers who serve, who provide ECM, CS, and CHW services. There is a slight change to the referral process for organizations that provide ECM, CS, or CHW services directly and would like to see those members return to their own organization. You can send those completed self-referral forms directly to your network lead entity, whether that be Full Circle Health Network or ILS, instead of sending directly to Kaiser. This just ensures that you're able to see the member, and that member will return to your own organization. For all other kind of referrals, whether that be from the community, from providers, from members themselves, they can either call our number or send a completed referral form. We'll obviously take Kaiser's referral form or Kaiser, but if you have other referral forms that you're leveraging, we will also accept those as well. Next slide. And this is just a quick overview of what that self-referral process will look like. So if you are contracted with Full Circle Health Network or ILS, you can feel free to send that referral directly to those 2 emails. And then I think there might be one more slide, but there might not be. Yep, and then if you are interested in serving KP members, feel free to reach out to Full Circle Health Network or ILS. We also partner with Partners in Care, but they are primarily serving Southern California at this time. We are still open to contracting and very interested in kind of meeting new providers to see how you can kind of best serve our KP member network. And I think that might be it, Navneet, unless there's one more. I'm happy to take on any other questions if folks have them. Great, thank you so much.
Thank you, Camille. We can move on to the next slide. And now I'll pass it to Ileana from HealthNet.
Thank you so much. I'm losing my voice, so bear with me. Good morning, everyone, or good afternoon. My name is Eliana Argueta, and I'm the Regional Program Manager here at HealthNet. to provide you a quick update for the sake of time and my voice, I'm going to be dropping some information in the chat, which these are our curated pages for our providers who are either interested in becoming a contracted provider with HealthNet, or if you are a contracted provider with HealthNet, tons of resources, including our end-to-end process for community supports, enhanced care management services, community health worker services, doula services. So there's an array of different resources you can find on our CalAIM resource for providers page. The second link here is the CalAIM resource for members. So these are our member-facing documents. These are documents that you can print and share with the community. Excuse me, with the community as you're doing your outreach, as you're beginning to talk to members about the services that your program may offer. A third resource that I will be sharing with Navneet and the Health Begins team is our provider network. It's been updated as of December of this year. And we're happy to announce we have one new provider join our provider network. This is going to be a provider in San Joaquin County under ECM services, and that's going to be the Central Valley Low Income Housing Corporation. They're going to be offering housing transition and housing tenancy services for San Joaquin members. So welcome to the team. Really excited to have you join the network. Again, I'll share the full provider list of network, our full list of providers who have joined our network with this team. And I think my ask here is to, if for those providers who are listed on our provider network list, if your organization contact has changed, if the method of referrals have changed for you, feel free to reach out to me and let me know. It's really helpful for us to keep updated information to really leverage the uptick of community referrals and enhanced care management services. Thank you to Nayeli from Health Fund of San Joaquin for raising the pre-authorization discussion. As you may know, HealthNet removed the pre-authorization for ECM services on 1/1/2024. So we're a little bit ahead of the game, which is great because it really is going to establish us really well as we go into 2025. And that really means that ECM providers are able to start serving members because the providers have insights and an ability to see if the member's already working with another provider through the provider portal. So that opportunity to see if the member's already linked to ECM services or community support services is already an available feature under our provider portal. But thank you so much for raising that. We also want to continue to share that, there's no wrong door for ECM and CS referrals, as our previous partners have shared. Please feel free to send direct referrals to the community support providers and to the ECM providers as well. We also want to continue to share that as MCPs, we're working on standardizing the ECM referral form with the hopes to have a co-branded form to really ease ECM referrals through the community. So that's more to come in 2025. And so no other updates on my end, but open to any questions. Okay, I don't see any questions on the chat, but again, feel free to reach out to me. My email is linked in the chat. Love to have a conversation with you, particularly if you're a provider who is interested in applying for PATH cited round 4 and you're currently not contracted with HealthNet, but that is a path that you want to go down. Please feel free to reach out to me. Let's start those conversations now, just to make sure that we really can support you as you're going through your application process. Thank you so much.
Thank you, everyone. So I think we can move on to the next slide. And this is one more poll about eligibility process knowledge. So we will launch that poll. And that is around knowledge of key aspects involved in assessing eligibility for community supports and enhanced care management, and whether that has increased due to your participation in the collaborative and collaborative hosted events. So we'll give everyone 30 more seconds to answer this poll.
I think if we can get Navneet maybe up to like 30 responses, that might be inclusive of everyone.
Sure.
We can give 10 more seconds.
Just really appreciate your feedback. Final call for responses. Okay, that prompted a few.
I think we're good. Thank you, everyone.
And then I think we can go to the next slide, which is our provider spotlight. So I will pass it to John.
Okay, so good afternoon, everybody. So today we have a really good opportunity to focus on one of the community supports that our organization utilizes every day. These three organizations have provided excellent services for our clients in receiving medically tailored meals. We have utilized all three, and all three have been outstanding to help our clients stabilize their medical conditions, whether it's in regards to dialysis, congestive heart failure, diabetes. These organizations will be able to assist you in helping your clients stabilize as much as possible through their food intake and through their medically tailored meals. So without further ado, I'd like to go to the next slide and present to you Isabella Bunker, who is actually from Mom's Meals. And take it away.
Hi, everyone. Thank you so much for having me. Thank you, John, for that lovely introduction. As you mentioned, my name is Isabella Bunkers. I'm the Community Supports Coordinator with Mom's Meals, and we provide medically tailored meals here in our community. So we were so happy to get the opportunity to support our communities and also just have this time to really show kind of what we're proud of this year. So I put up on this slide some successes from the past year that we're super proud of. So I'll just kind of go through and say the gist of it. But number one, so this comes from, these findings come from a nutritional session with our registered dietitian, but this member was receiving 12 weeks of meals, so 2 meals per day of our diabetes-friendly meals. This member had a history with type 1 diabetes, and as well as other health and mental health issues. She states that prior to Mom's Meals, she was severely underweight and with an extreme lack of energy. She also has a 10-year-old son and found herself prioritizing providing for her family over herself and had really poor and inconsistent intake. With overall just very poor nutrition. But since starting Mom's Meals, she found that she had a lot of energy back and is able to play with her son, be able to reconnect with her family. And she also saw improvements in her physical health. You know, she lowered her A1C and she gained the appropriate amount of weight. And she has asked to continue on our meals to help provide adequate nutrition. So I just love this example because it shows that meals are so much more than just the nutrition that's going into our body. And it actually supports us with a well-rounded and healthy lifestyle all in all. And then one of my favorite things that came through our feedback survey this year was from member number 2, who used so many exclamation points. I had to take some out, but they mentioned they just love our meals, eats everything up that we send. And in the past, she states that she would forget eating, but because we call and because we care, she always makes sure to get her meals and she's able to eat those meals. So she's getting the proper nutrition that she needs. She loves that we are personal and kind, and she gets to pick her foods because we allow all members to get a choice of every meal. And so she said that we were on top of our game, and there is no greater compliment than someone in the community. So we just are so grateful for 2024 and what this year has brought us in this lovely community. And we just would love to say that participating in this PATH CPI has connected us to other amazing providers in the community. And we've really appreciated being part of resource fairs where we can meet the people that we are serving within the community and receiving the members. So with that, I will just drop in the chat the link to our community supports website where you can learn more about Mom's Meals if you're interested. And then I'll also drop my email. But again, thank you so much to the Health Begins team for giving us this opportunity. We are so happy to be entering 2025 with such a lovely team. So thank you.
Okay, next slide, please. All right, so now we have GA Foods, and Janet Yu is going to be speaking on behalf of her organization. Go ahead, Janet.
Wonderful. Thank you, John. Good, always is good to see you. Thanks for the intro. And Isabella, thank you again for that great information about your wonderful successes. So I'm Janet Uy here with GA Foods, and I'm the Director of Healthcare Partnerships. Thank you again for Health Begins, Navneet, and Melissa for giving us this spotlight to really express our gratitude, most of all for this great year, collaborating with everyone on this call. Names are familiar for folks that we've been able to really highlight and be part of this wonderful platform. One of the vital reasons as to why these medically tailored meals exist is really having a trusted partner solution to help prioritize the meals and nutrition program overall to improve the members' outcome. So as Isabella has mentioned, lots of successes with individuals that have gone through some really critical conditions of their life. And we really want to be part of those critical moments and helping meet people where they are at regarding their health and their nutrition, prioritizing their food and diet behaviors to prevent some of those instances in their lives. So GA Foods really is here to help provide your medically tailored meals, also your shelf-stable meals and grocery boxes, as well as nutrition support. So one of the things that I think this platform has been able to provide to us is working together. How do we find ways to improve not just current processes, but really to understand our clients in totality and helping to acknowledge what do we need to support them with outside of, meal support. It could also be some other things that we have our ability to identify some of those other social determinants of health that our clients and members are undergoing. One of the things that our GA Foods strive against is our delivery care team and our registered dietitian and our customer care team overall are really the extensions of this care support, not just from the health plan, but understanding what other conditions these members are undergoing. So we are definitely the care pathway to support the providers of any situations that they've identified with their patients or clients, really working closely with the community agencies, the local CBOs and the hospital systems and so forth, and just to really be present during those critical moments of the patient's life. So again, I can drop off our information via the chat here. Really been successful with partnering with the general hospitals, with some of the local hospice centers, mainly even case management team really has been able to help support them and identifying those individuals and closing the loop with the referrals that we've been able to receive. So 2024 has been a huge success, been able to be part and embed our services within the community. We look forward to more 2025 platforms where we could really collaborate and identify more individuals that's going to need more support. We know 2025 will have some changes around the definition of what medically tailored means, but overall we're here to support, be an extension of your care pathways for your patients and clients. And with that, happy to drop off information. That's my website is down there below. You can contact me at juy@gafoods.com. Really here to look forward to working with everyone for 2025. Happy holidays, and thank you for having us.
And to the last slide, or the next slide, I should say. All right, and so we have the Roots Food Group, who we recently just put on board with one of our medically tailored meals organizations that we offer to our clients. And so now we have Sarah. Go ahead, Sarah.
Wonderful. Thank you so much, John. Can you hear me okay?
Yeah.
Awesome. Okay. All right. Excellent. Just wanted to double check. So my name's Sarah. I am a community support specialist and dietitian at our FoodX, formerly known as Roots Food Group, but we will catch everybody up on that at a later time. So we have a medically tailored meal program for those with Health Plan of San Joaquin or HealthNet. So we went in a little bit of a different direction with the prompt and looked up a couple statistics for the number of residents in these regions in 2024 that we served that had Health Plan of San Joaquin or HealthNet, and that totaled over 290 individuals. And then in terms of the number of meals we were able to serve to them, that equaled 48,780 meals. So we're really proud of these numbers, and we just hope to, be able to help even more people in 2025 and continue to grow. And another highlight was our partnership with Meals on Wheels in San Joaquin County. We were able to help those that were added to their wait list. When we were first approached, there was a year-long wait list, so they were able to refer the individuals seeking their services to us so we could get meals into hands a lot quicker. And I personally spoke to many of these individuals, and I'd say just the kindness, the gratitude, the graciousness that they expressed was really touching and definitely one of the highlights of my work with this company. In thinking about how this group has been helpful, I mean, it's just been hugely helpful in getting to know the other organizations and providers that serve the same individuals that we can help. So it would have been a lot more difficult without this path. And, I joined our FoodX about a year ago, and so had a lot to catch up on in terms of understanding the CalAIM landscape and the area, and couldn't have done it without you all in this team. And then with the pictures here, so this was our entire team. We actually got together last week for a team event. So this is our operations team here, our amazing customer service team, and then the other community support specialists that are in the communities in California. So thank you so much for allowing me to present. My email is actually incorrect in the slide, so I'll go ahead and drop that in, but please feel free to contact me if you have any questions about our meal program. Thank you.
Wonderful. So thank you so much for presenting. All three of you ladies were excellent. Like I said, our organization utilizes all three of their organizations to provide medically tailored meals to our clients. So can we get the next slide, please?
Hey, John, can I ask a question?
Nai had a question. Go ahead, Nai.
I'm sorry to be interrupting you. The presentations are really great. It's really good to know that there's options here with medically tailored meals. Is there a way that there could be a follow-up to this presentation that talks about which health plan each of the organizations are contracted with, not only HealthNet, Health Plan of San Joaquin, but also Kaiser, right? And then if they could also talk about their similarities or differences, or maybe highlighting their key features, because we know that the CS benefit is the same, but if we were to make a referral, it would be really nice to know what their strengths are or the expertise to be able to make the right referrals.
Nai, you are great. I love that. Yeah, there are reasons why we may very well pick one towards another because of exactly what you just stated in regards to the offerings. But yeah, that would be great. We can do a follow-up, and I know Health Begins will put that together. So we'll do that shortly.
Thank you.
Thank you. All right, so can we get to the next slide, please? So now we have another audience poll. So this is in regards to provider relationships. So over the past year, how many relationship connections have you in total with local providers due to participating in, let me restate that again. Over the past year, how many relationship connections have you made in total with local providers due to participating in the collaborative? So we have 1 equals to 0, 2 is 1 to 3, 3 is 4 to 6, and 4 is more than 6. And we can give you guys about 30 seconds to answer that poll. Okay, so did we get the
Let's
poll?
give it 10 more seconds, one more push for, and thank you so much for bearing with us on these polls. There's 2 more, just as a quick warning, that there is 2 more polls coming your way. So once we get these responses in, we can move forward.
Okay.
John, did you vote?
Yes, I did.
Okay. Hopefully John is leading by example for everyone. I
No,
think
and over the past year, I could tell you that I've connected with more than 6 local providers providing CS and other ECM providers within San Joaquin and Stanislaus. So kudos to the CPI, kudos to Health Begins, and allowing us to be able to network and connect with other, agencies out there that are being impactful to everything CalAIM. So yeah, if without the Health Begins and CPI, I probably would have never connected with more than 6 other organizations. I would have, takes time because the managed care plans do provide those resources, but this gives us an opportunity to meet people through faces, through talking, through asking questions, which is just another avenue. So really good.
Quickly flashing on the screen kind of the results here, because I do want to show everyone that at least the majority here have built relationships over the last year. So really grateful for that. Okay, I think we can move to the next slide, John.
Yeah, next slide, please. And so this is an opportunity for people that are on the call to be able to tell us, what things are going on with them. Do you have any updates or spotlights you'd like to share with other ECMCS stakeholders on this call in San Joaquin County and Stanislaus? This can include any upcoming events, any meetings, recent successes that peers would benefit from knowing, and anything else. This is another opportunity for us to connect, like I said, to make those networks, to be able to be impactful within the communities. I guess everybody's shy today. Do you want me to pick people? No, just playing. I wouldn't do that. I wouldn't put anybody on the spot. But I'm trying to think. I can tell you that, during our last CPI session when we had it with the binational event in San Joaquin County, that it was very, very successful. There were lots of organizations that came out. Just another opportunity for our ECM and CS providers to meet with the end users, the clients, and that's kind of what it was all about. So I just want to say kudos to everybody that came out, that made it a success, and hopefully we'll have another one in the spring. So keep your ears open for that.
Thank you. I think we can go to the next slide.
Yeah, next slide, please.
Okay, I think this is me. So we are going to go over some next steps. We're going to see 2 more polls right now, and then we want to hear a little bit from you. So as we mentioned, this is the last of our sessions for 2024, and we really want to go into 2025 highlighting your successes. We've done a little bit about early on today, but really want to get some of your input and feedback on like what you guys want to focus on into the new year. There's a lot of policy changes coming up and updates. We've also talked about hosting in-person meetings and really collaborating more. And so I will invite you all to turn on your cameras, at least for the next 10 minutes, unmute, and really engage in discussion with us just for a short period of time. But next slide, please. I gave you guys a warning. We are doing one more poll. So over the past year, we've shared a couple of resources. We have the Google Drive folder. We've created some contact lists that have been disseminated during in-person sessions. We've sent out contracting 101 guidance and things like that. I know the titles to these, you might be like, I'm not sure what this is, but if we can go ahead and share the poll, just kind of want to see in the past year, if you've used any of the following resources, if they've crossed your desk or you've reviewed them at all. just to kind of see what's helping you guys and what's been most effective as we've shared things through the collaborative. The ECM and Community Supports Guide is that kind of two-sided page document that shows the different types of enhanced care management and community supports that are available in the community. We did disseminate this through the in-person resource fairs and have shared that out to community members as well so that they can determine their eligibility. So if you've used that, please go ahead and check that off. The Contracting 101 guide, we shared this during the September in-person session. We had a small breakout around that and kind of shared that with everyone. It demonstrates the different types of contracting paths for each of the 3 managed care plans that we have. And then we have the regional contractor provider list, monthly session decks. We have a shared collaborative folder. I'll give it maybe 10 more seconds on this one, and then we'll move on to the next poll. And if you haven't used any of these, that's okay too. Just kind of curious to see what people are using the most. Okay, I'm going to go ahead and end this. Thank you all for participating. And I'll just kind of show here. So we're seeing ECM and Community Supports Guide is probably the most used, and the contracted provider list. So really great to see that kind of use across the board, but I think those are the most popular ones that we're seeing. Next slide, please. Okay, so over the last quarter, we've done a little bit of information sharing around data exchange practices, different types of data exchange that you can engage in. And so if we can start this poll, this one is after this quarter's sessions, October through December, how familiar are you with the different options available to improve data exchange efforts with other providers? So that includes using provider registries, HMIS, 211, and I see we're already getting requests for the contractor list. Yes, I think if Navneet, you can share that in the chat, that would be helpful. And I will give this one 10 more seconds and then we'll move forward. Okay, let's go ahead and go into the next slide. All right, we're going to engage in a little bit of 2025 planning, and just to set the stage, next slide, please. I want to highlight some of the regional successes. So we've mentioned this, but I think seeing numbers and actual kind of pointing out who and what did things is super helpful. And this is not for the entire collaborative. This is just some of the things that we've pulled out over the last quarter and across the year. So there are many others. We've hosted some resource fairs. So we hosted an ECM and Community Supports resource fair in San Joaquin and one in Stanislaus County to strengthen provider referral coordination and market awareness. Over the last quarter, we've secured attendance from 30 unique organizations and have seen attendance from 32 new participants, especially during the CPI in-person session. We've also seen really great provider collaboration. So San Joaquin Health Centers, St. Mary's Community Services, and Behavioral Health have collaborated successfully to transition 2 individuals from encampments into recuperative care with housing vouchers to assist them in finding stable housing. These are just a couple of the regional successes that we've observed, and of course, there's many more. You guys heard from Medically Tailored Meals today and from previous participants in the collaborative. But just really want to give everyone a pat on the back, round of applause for all of the great work that you're doing in your regions. And we're really looking forward to continuing that in 2025. So we have a couple of questions for everyone as we move forward, but if we can go into the next slide. I know we've already collected some feedback from you guys, but DHCS does ask for collaborative feedback, and so we'll be dropping this link in the chat in an effort to improve the collaborative and give improvement efforts here. We do ask that you participate in the survey. Your response will be kept confidential, so we don't see anyone's responses. PCG and DHCS will filter the information and share it back to us. And this survey will take about 10 minutes to complete. Next slide. Okay, so what we really want to do now is gather some of your insights to guide 2025 planning. One of the questions that we have is, what are your top priorities and aspirations for next year? Specifically, what's the envisioned direction or key goals for your enhanced care management and community supports implementation in 2025? And I'll open up the room here to see if anyone wants to share what their goals are for ECM and CS in the new year. Janet, I see you come.
Hi, sorry, I couldn't get off of mute. Really just want to continue this great partnerships that we've created in the community, and also working through closing the gaps a lot more than where we've been. And then the cross referral, I think being partnered with different ECM providers and community support providers, really want to detail those, flush those out a lot more as we find ways to close loop the referrals amongst each providers. I think majority of what we've learned here is there's definitely a tool. There's processes in place that works, but how can we make those processes, tools work across the board? So I kind of look forward to what we've learned here in the last year, and ramping those up for 2024 and kind of making advances to what we've already learned here as a group. Hope that makes sense.
Yeah, thank you so much. We have two other questions, and since I already have you, is there anything that you would like to share as to how we can make the collaborative more effective, or reflecting on your experiences over the past year? Is there any aspects in your participation that you found the most valuable? I know some have mentioned the resource fairs were really great, but just kind of curious to hear from you in regard.
I think you might have mentioned it in the last slide about an in-person. It's always so effective. I think this platform virtual is always great, but when we do come together, I don't know if it's going to be every other month or whatever the schedule will be, having those in-persons are a lot more empowering. Kind of whiteboarding things as ideas come flying across, and definitely those resource fair, John, your group, your team, and helping seeing those individuals during those community events is really, really great to be present. So the more of those resources, absolutely.
Yeah, Ines, I saw your comment in the chat, and I also see you on camera, so I'm going to welcome you to unmute and share if you'd like. I think you're muted. Nope, can't hear you. I think we can go in the chat. So what I see is to be more efficient and have more support and funds to pay for our staff to help the community with referrals. Are those your organizational priorities or kind of in general? Anybody else want to share?
Well, I can go and add that, our goal is to scale up more. We are impactful now at 16 social workers, and we definitely want to add more social workers to our team to be more impactful in the community and to connect to other agencies like El Concilio. A lot of our clients that we are working with now are migrant farm workers that are connected to the managed care plans, and we definitely need to build that relationship that we have with El Concilio. So scaling our team and then connecting with other agencies to help our populations out there in the community. So that's basically what our plan is for 2025.
John, can you share a little bit about maybe how the collaborative can deliver the most value in 2025 for you and maybe your staff? I know that you kind of support as a SME, but as you kind of look at the needs of your staff, what would be helpful for them to hear about and learn about here in the collaborative or from other providers?
No, that's a great point, Melissa. I think I need to ask my team to be on these calls more often. I do have, one person on this call, one of our supervisors for Stanislaus, but for them to really get the gist of what we're trying to do, that's probably going to be my goal, is to get them to be more involved in these phone calls, and to have 16 other people on these calls to see and know of the other ECM and CS providers that are on this call, and then to get to know people in the managed care plans, like Ileana and Nieti. These are people that I believe would be great resources for them to be able to connect with, because I don't know all the answers and I don't know all the questions they may very well have. So to get them on the call, I think that would be best for our team, and to expand the CPI that way.
Thank you. Ines, I'll welcome you back if you'd like to unmute and share.
Yeah, we are currently in dire straits, and I really appreciate this collaboration, because I think with a lot of our agencies, especially with providing free food to the community, our lines have gotten bigger and bigger and bigger, and the need is getting bigger and bigger and bigger. So this has been so wonderful, and I hope that this collaboration, this network, will help us be more effective in helping connect our families to the services that they need, whether it's health, whether it's food, or other components, for them to be successful and be healthy. So I really appreciate you in doing this, and thank you. Every time we do this, I learn something new, and I'm really excited to share this with our team here. Thank you.
Thank you, Ines. Anyone else want to answer kind of question 1 here? So I want to build a little bit on the areas that we should prioritize. Most sessions, we try to keep them general, and we'll share policy updates and things like that. And others, we'll highlight providers. Today, we highlighted the medically tailored meals, and I know you talked about maybe elaborating on that or building on that. We've done a lot of information for housing providers and the different types of housing providers that are available in your regions. But one of the questions I have is, are there populations of focus that you're interested in hearing more about, or providers within the different populations of focus that you would like to learn about? That'll really help us inform the types of provider spotlights that we bring into the next year. I know in some of our other collaboratives, we've done a huge focus on justice involved. We've heard about individuals being really interested in the birth equity population of focus, or the children and youth population of focus, how we can bring in the school systems, or hospital health systems. And so just kind of curious if any of that is of interest to you guys. Would love to know that, so that we can start integrating that into the sessions. But without your input, it's hard to really drive the sessions in a way that aligns with your needs too. John, home modifications. Do I have any home modification providers on the line today? No, none. Okay. Any other topics you guys are interested in? Maybe I can get a thumbs up for children and youth. Anyone interested in that?
Hey, Melissa, it's Eliana from HealthNet. I think children and youth is definitely one population that we want to focus on. And we have, to be honest, we've been leveraging, at least in Stanislaus County, our connections with Ashley, I think she's the director of the CCS programs, and having an opportunity to kind of meet and greet with the CCS coordinators and the 3 MCP provider network, contracted provider networks. And so that was a really great opportunity, again, for that meet and greet, and just really to expose both ends, right? The CCS side and the ECM providers, on where do we leverage each other, and where do we say, okay, CCS kind of takes care of that action of the work. And then if not, then where does ECM come in? I think that was really helpful. It would be something that we could maybe leverage continuously as we continue to bring on more children and youth, or identify more children and youth are eligible for these services.
Yeah, thank you so much for that, Eliana. I see some head nods, and others are not on camera. So if you're nodding your head, I can't see you, but anything else that you guys want to share, and then we can kind of move forward. NCP transportation services, hospital and health systems would be super helpful. Okay. This is all really helpful. Thank you so much, guys. Next slide, please. All right, so we do have a sneak peek into the next quarter. So in January, we'll be focusing on kind of continuing the 2025 goal setting. We'll share some policy updates, we'll share general announcements, potentially population of focus highlights, and a real focus on cited round 4. So I know a lot of you mentioned that you are planning on submitting applications for cited round 4, and so we will focus in on that in January. In February, you can start to mark your calendars. We are going to be hosting an in-person convening and in-person office hours. Our goal is to host quarterly in-persons, and so hopefully that's kind of in line with what you guys are looking for in terms of that in-person interaction. We do have the date, and this will happen in Stanislaus County. So we'll be jumping between the 2 counties every other quarter. Wednesday, February 9th, 11 a.m. to 2:30 is the time slot right now. We are looking for a location for that, and so we will provide more information on that in January. And then March, again, we also have general policy updates, announcements, population of focus highlights, and provider spotlights, and more. And as always, office hours. So the kind of content information will be available pretty early on. We'll be trying to share that out in advance so that you guys can determine which kind of staff need to be attending these sessions. So for example, if you're not able to attend or the information doesn't align with your specific role, but it does align with another staff members, we really encourage you guys to invite those staff members in your stead. But yeah, that's what you guys can look forward to over the first quarter. Monthly sessions will continue over the next year, and topics will vary over the monthly sessions. Next slide. So next steps, as a reminder, we do have the PATH CPI participant experience survey. I believe a link was shared in the chat. This Friday, we have our cited learning lab. So that is being hosted by Health Begins, as we mentioned earlier today. It's about a 45-minute session. If you're applying for cited, really encourage you to join that. It is more of a peer-led informational session. DHCS will be hosting a series of sessions as well, but this one will be specifically for San Joaquin Stanislaus and hosted by HB. And then join us for the January session. So that session is happening January 27th at 1:30. There is a registration link that is being dropped in the chat now, so you guys can start registering for that. But that is all for San Joaquin Stanislaus. I really wish you guys a happy holiday and happy new year. Thank you guys for joining us, and we're looking forward to seeing you all in the new year. Have a good day.
Thank you.
Bye, everyone.
Bye-bye.
Everyone.